Virtual reality is a digital therapeutic. In the era of digital medicine, there is a huge interest to understand how digital therapeutics can help medicine. In our case, we target chronic pain, people who suffer from pain at least since 3 months, and much longer, sometimes years or an entire life. So the goal is to find mechanisms that are an alternative to opioids and other pharmacological approach to understand how virtual reality can mitigate pain. And the goal is to help patients to cope with their pain, but also to restructure the neuronal mechanism that sustain pain. In our lab, we have been exploring how mindset, expectations can change perception of pain. And when we talk about placebo and nocebo, we refer to improvement of outcomes related to a substance that is inert, fresh water, solid solution, talc, pills that per se don't have an intrinsic mechanism of action. Our goal is here to understand how mechanism that we all have, part of our brain, can mitigate pain experiences. That is why we are interested in placebo, positive, and nocebo, negative, mechanism of modulation of pain. We put together a protocol to bring the headset in home setup. So we contact our patient with chronic pain. We offer to be enrolled in a virtual trial. We FedEx them the virtual reality with the electronic consent, and we ran one of the most elegant study, show how we were able to translate from lab to hospital to at-home setup the power of virtual reality. The paper has been published recently in Nature Digital Therapeutics and show that 20 minutes of virtual reality daily can mitigate clinical pain intensity, clinical pain unpleasantness, clinical pain interference, improving sleep, mood. I can try to describe how the patient perceive virtual reality by sharing some of patient testimonials. And so we had the patient with fibromyalgia experiencing this jellyfish with pink noise and nature ambient music, wearing the goggles, and they say, oh, my pain disappeared. Fibromyalgic patients have this widely spread pain, and often the way they describe pain is as something excruciating and very, dramatic. See this patient smiling and see this patient sharing with us, my pain disappeared, made me even more interested in understanding what is the mechanism beyond the virtual reality. I can share with you the experience of one of our participants because we published his testimonial. He was also interviewed by the local TV. He was using oxycodone to control his pain, and he realized and shared with the family that this oxycodone started to create dependence, and he was concerned because he had suffered of addiction 20 years earlier in his life. So he enrolled in our trial, and he mentioned that soon after using, after a few days, he didn't feel the need to control pharmacologically, and in particular with opioids, his pain. So a situation like that stimulates us to expand from chronic pain to cancer-related symptoms, but also we are tackling this difficult question of dependence of many chronic pain patients on opioids. So that will be our next chapter, to try to understand if virtual reality can help patients to mitigate opioids use.